Welcome to the Cabral Concept, where board-certified naturopath and integrative health practitioner Dr. Stephen Cabral shares how he was diagnosed at the age of 17 with a life-altering illness and given no hope for recovery. It was only after studying and traveling all over the world did he discover how to combine ancient Ayurvedic healing practices with state-of-the-art naturopathic and functional medicine to fully rebalance the body and re-energize it with life. It's time to discover how to get well, lose weight, and finally feel alive again. And now, here's your host, Dr. Stephen Cabral.
Welcome back, everyone. We're here today on a brand new Cabral Concept, episode 2357 of the show. Can't wait to get into today's topic, which is how birth control negatively affects your body and mind. It was also going to be called, I had a different name, different theme in mind. It was what your doctor won't tell you about the dangers of birth control and oral contraceptives. Why this is so important and why I wanted to bring this information to you is because literally your OBGYN or your PCP or whoever is prescribing your oral contraceptives is not going to share with you the big 5 dangers, and yes, they are dangers of using birth control. Now, before we get into the topic of birth control, I'm not here to tell you to use birth control or not use birth control for yourself or with your children, meaning teenagers or whoever it might be. That is your choice. That's your decision to make in life. It's not my job to tell you what you should or should not be doing. And I also understand that it's a challenging situation because you might be using birth control. Again, I don't believe it's the right reason to get rid of certain symptoms like PCOS symptoms that I've talked about many times, which have an underlying root cause, or skin issues, or mood, or other things. Again, always look for the underlying root cause. But if you're using it as birth control, then you may want to look into other alternatives. But again, I understand if that's the decision you choose to go with. I'm not here to say whether it's right or wrong. These are many challenges and difficult decisions in life. What I do want to share with you is what to watch out for, especially if you or, of course, someone that you care about is on the pill, or again, we'll refer to it as birth control, oral contraceptives, the pill. So let's get into it. So basically, the bottom line is what I've chatted about with you before, what I just talked about PCOS or symptoms of estrogen dominance, skin issues, or mood disturbances, or weight gain, or any PCOS-based symptoms. It's not the right reason to go on birth control. I really don't believe that it is because PCOS always has an underlying root cause. There's about 6 to 7 different reasons as to why women have PCOS-based symptoms. And we go through that on many past podcasts. I'm happy to always get you those. If you can't find the shows at stephencabral.com/podcast, you can always just ask inside of cabralsupportgroup.com, and my team would be happy to help you find those shows. So let's get into it. First, big danger that your doctor will absolutely not talk to you and tell you about in terms of how birth control negatively affects your body and mind. The first is altered mood. So interesting quote. This was given actually on a TED Talk, but I have every single one of these that I'm going to chat with you about today and bring up are all backed by peer-reviewed scientific research. And I'll link all that research today at stephencabral.com/2357. stephencabral.com/2357. I'll give you all of the research if you want to look deeper into it. All right, so check out this quote. Anxiety and depression are very common among women on the pill. Almost half of all women who go on the pill stop using it within the first year because of intolerable side effects. And one of the most frequently cited is unpleasant changes in mood. So again, anxiety and depression are the most common. However, I pulled up some, again, peer-reviewed research. Typically, the research that I'm using is from PubMed. And what you'll find is that women actually have a higher stress response while on birth control. So their levels of stress may be more exaggerated in their own mind when on the pill. And that's because we know that the body affects the mind. That means our physiology, which is our body, we'll call it our nervous system, links up to our brain, right up the spinal column, to our mind. Our mind is what gives us these thoughts and these feelings and these emotions. So we have to understand that it's a two-way street. It's not just mind telling body what to do. It's also body telling mind what's going on, what may not be proper inside of the body. All right, so that's number one, is altered mood. If you're dealing with or you see higher levels of anxiety or depression, it may not be a reason to go on an antidepressant or an anti-anxiolytic or something to reduce stress. But again, I'm not here to give you medical advice, medical treatment plans, medical diagnosis, but I would certainly talk with your doctor about this, that, hey, could it be the birth control? Here's a study showing that this is very common, this is very prevalent in women that go on the pill. All right, second one is this, altered digestion. Almost no one knows about this, that women who go on an oral contraceptive have most likely poor absorption and depleted nutrients of these specific vitamins and minerals. First is vitamin C. Second is vitamin E. Third is magnesium, then selenium, and then zinc. When looking at other B vitamins that can often be depleted, it's vitamin B2, riboflavin, B6, paradoxal 5-phosphate, B12, methylcobalamin, and B9, folate or folic acid or methylfolate. So those are often depleted. Now, again, that's proven by science, and I'll link all of those up for you. So that's not good, right? And here's why, and then I want to give you the other side to that as well. All right, vitamin C, very powerful antioxidant, helps with the immune system, helps with modulating inflammation in the body, helps with detox, so much. Magnesium, though, zinc, that's zinc and selenium mixed together. I could just call it selenium. We'll just go with that little nutrition-based humor. Probably only myself would find that humorous, but that's okay. And then all of your B vitamins. So what you're looking at is, okay, we have one study, totally disconnected to this study, is saying poor stress response, higher levels of anxiety, more depression. Well, is it any wonder? Because anxiety, depression, and poor stress response are all related to lower magnesium, lower B vitamins. Okay, so again, what came first? The stress, right? Or the depleted vitamins? Well, I would say both, right? So if the hormones are making you feel more stressed and your body simultaneously is not absorbing as much zinc or magnesium or B vitamins, you're going to have a poor stress response. Same with vitamin C. So this is crucial. This is why conventional medicine, albeit like phenomenal for acute-based critical care and like emergency rooms, et cetera, they get a failing grade when it comes to connecting the dots. Very few of your doctors are going to be able to connect anxiety, depression, poor stress response to being on oral contraceptive, which then would be linked to poor digestion, malabsorption of these nutrients. But even if they were to get that, well, then that means that they were an all-star and they definitely did more education outside of their schooling, which is, admirable. That's fantastic. Again, most of the postdoctoral work that I did was inside of learning functional medicine, et cetera, like just going deeper on that. Most of them were medical doctors. So I want to give shout outs to all the medical doctors, nurses, nurse practitioners, chiropractors, et cetera, that took it upon themselves to look for root causal based reasons with their patients. And so I think that's really important to look at. Again, I know that not all medical doctors fall in this camp, but to be honest, it's not really medical doctors' fault. Not at all, nor do I blame them. It's not taught in American institutions for medicine. So again, you go to your doctor, you have your blood work run, help with acute-based illnesses, but you really need to be working with someone who's an integrative practitioner, integrative health practitioner, looking at it from all angles. And that could be a naturopathic doctor. It could be a chiropractor with postdoctoral training in this. It could be an integrative health practitioner. It could be anyone that is able to help you at a much deeper level. And of course, our team over at Equal Life can help as well. But here's the thing. So even if you understood the poor digestion part of it, what isn't realized is that high copper is extremely common in women on oral contraceptives. And it's not because they're using maybe an IUD or copper in some way inside of their body, but it's not that. It's here's what it is. You have to understand is that, and again, conventional medicine is reductionist, meaning like, okay, you have a high cholesterol, you're going to be put on a statin. If you have high blood pressure, you're going to be put on calcium channel blocker, beta blocker, et cetera, right? It could be not a million, but a half a dozen things that you're put on. So we have to understand this, though, is that everything has a partner. So if you're lower in zinc, poor absorption, naturally copper begins to increase in the body because zinc is its antagonist. So if you take in more zinc, it pushes down copper. That's why, again, you have to be careful over time using too much zinc. That means like 75 milligrams or more a day. We recommend something called balanced zinc. That is the right amount of zinc to copper ratio every day. Now, of course, you get a cold, you can definitely up your zinc for a period of 2 or 3 weeks. That's not an issue. So here's the thing though, high copper can lead to what? Anxiety, mood disturbances, skin rashes, poor immunity, learning disorders, and much more. Again, so like we really want to look at this in depth. All right, so we know now altered digestion is part of this. The third one is this. Poor, well, I shouldn't say poor. Let's characterize this specifically. Altered bile and gallbladder function. So what do I mean by that? Well, again, I should probably pull my model over. I haven't used my buddy Walter over there in some time. If you're watching this on video, I'll just adjust so that you can see Walter a little better there in the corner next to my foam roller right over there. And your gallbladder is basically, think of it almost like a little, like a little pump, like a little that you might use with a infant child as you're trying to siphon mucus out of the nasal passages. But that little bulb, that's what it looks like, attached to the liver. And so that's going to store a lot of bile. Well, numerous studies have now shown that this is the direct quote, and this is from, I believe it's PubMed. This looks like online library from Wiley. I'll link this up as well. It says, routine administration of oral contraceptives to healthy women in doses and formulations commonly prescribed is accompanied by a significant rise in cholesterol saturation of gallbladder bile. Well, what can this lead to? It can increase bile stones, gallbladder dysfunction, leading to having to have your gallbladder removed. So that's not ideal, obviously. Increased cholesterol, not really ideal. It could lead to acne and other issues as well. It could lead to increased hormones in other parts of the body. But also, and this is important as well, we see that there's reduced bile flow in women on oral contraceptives. Why does that matter? Well, the reason is this, that bile is meant to drop into the small intestine after basically, or with meals, I should say, to help dilute the low pH food, the chyme, basically it's called, coming through your pyloric valve of the stomach. So let me put that into English. I'm like searching for the words in my head to make this a very approachable topic. So when you're digesting food, it's going to move from the top of the stomach called the fundus down back into the bottom of the stomach because the stomach's actually shaped like a kidney bean. And in the bottom, it's called the pylorus. So that is where the digestion, through the pyloric valve, it's going to move once the food is broken down into almost like a soup. So it's all broken down and it'll move then into the first part of your small intestine through a little valve. And that's called, again, the pyloric valve. And just a little bit at a time, not all at once, just a little bit at a time. It opens and then closes, opens and closes. Let's say about a teaspoon at a time. So then it comes into the first part of the small intestine called the duodenum. And this is where now your bile acids are going to meet your stomach acids. Now, bile acids might be a little bit more of a misnomer because the pH of bile can be rather high. And so that's going to meet the lower acid coming through because of the stomach acid mixed with the food. And that's going to neutralize it. And what it also does is help break down fats. So I gave you all that information for a reason, because a lot of women on birth control end up having bloating and distension and other issues. They're not able to break down fats as well. They're not able to neutralize a lot of that food chyme. It's just the broken down food that's coming in the intestines as well. So could it lead to SIBO or could it lead to other disorders? Yes, potentially. And again, I can't give you that medical diagnosis. But I want you to keep that in mind. Why this is important is because now we're moving into part number 4, is that this helps with detoxification in the body. So the bile, if it gets congested, that's not a good thing, because your bile is actually picking up toxins as it's processed through the liver to be eliminated through the intestines when you have a bowel movement. That's why having 1 to 2 bowel movements, sometimes even 3 a day, would enable you to get those toxins out of the body. So that's obviously crucial, but that bile again carries with it those toxins. So you have to get it out of the body. Now here's the interesting thing, because besides besides bile being affected, which flows through the liver is also affected, which means detoxification could be affected. This is crucial, again, because if you have poor detox, you might have higher levels of inflammation, headaches, migraines, autoimmune, skin conditions, skin rashes, brain fog, etc. So besides the risk of gallstones, what I talked about with the bile being congested, let me give you a direct quote as well. Estrogen and oral contraceptives are both associated with liver-related complications, including intrahepatic cholesterol stasis, sinusoidal dilation, hepatitis, these are all, I'm not going to go through all the different terms. These are basically all carcinomas, blockages, and inflammation of the liver and gallbladder. So what it's saying is that when your liver gets backed up with bile, just like your gallbladder, you're not going to be able to process phase 1, phase 2 detoxification properly, and it's going to lead then to a host of other issues that you probably won't relate to oral contraceptives. You'll be like, oh, I wonder why now I'm getting headaches or migraines or brain fog or inflammation or maybe even these autoimmune issues because I can't properly detox my body. Really important to look at that. I have a free toxicity quiz. I think it's really important to take for everybody, but certainly for women on oral contraceptives. By the way, it's completely free. It's literally free. Just go to stephencabral.com/assessments. I probably have a dozen assessments right there. They're what I use in clinical practice, and they're yours free to use. Feel free to take it, see where you score on any one of those. All right, and the last one is this. It's infertility. And the reason why I bring this up is because so many women have come to us in our practice. They've come off birth control after being on it for years, sometimes over a decade, and they have a difficult time getting back their menstrual cycle. They've been on it for so long that their body doesn't know anymore how to properly regulate estrogen, progesterone, FSH, follicular stimulating hormone, and luteinizing hormone. I have a whole case study on this, so I would definitely go to stephencabral.com/podcast. Along the right-hand side, you'll see little orange bars. You can click on the one that says case studies. I go through lab case studies once or twice a month from the actual practice. These are real people. And I just share with you oftentimes what it looks like when the body has gone awry. And of course, just remember, everything is fixable. So some women, we can reset that cycle within let's say 2 to 3 months. So 2 to 3 cycles. Obviously, you have 1 cycle per month. And if you're not having a cycle, that's what we have to work on. And some women it takes a little bit longer. But the goal is that we don't give up if you don't give up, and we'll make sure. And again, our job is to help you get your body rebalanced. So really important to look at all those things. Probably the best way to look at the overall function of the body is with the big 5 labs. Again, you can run that with any practitioner that you want. If not, the starter kit is my recommendation, which is 2 labs after that. And then the other one I would add on is the stress, mood, and metabolism test for sure to take a look at those hormones. So again, I didn't even go into today all the issues it can cause with that oral contraceptives can cause with skin rashes and everything, believe it or not, to actually choosing the right partner for you. And if you've never heard about this, you can actually just Google it. I'm probably not going to do a full podcast on it, but taking an oral contraceptive actually changes your scent for certain pheromones for the right partner. That, interesting enough, that conventional medicine or conventional science or medical science is looking with psychology, the best of psychology, to say that a woman may know who her best potential partner is, and a lot of that having to do with pheromones. So really interesting. Again, I love the science, I really do. And of course, I'm always blending that with the best of ancient wisdom as well from Ayurveda and all the different disciplines from around the world. Hopefully this was helpful. Let's get the word out there. Again, I'm not telling you what to do, but I just want you to be aware, and you can always be aware even if you're on oral contraceptives, birth control or not. So again, all the show notes are at stephencabral.com/2357. Feel free to share the show with anyone you believe it could serve. Take care, everyone. Did you know that the body really only becomes sick or imbalanced in only 2 ways? Over time, you become deficient in vital nutrients, and you also accumulate toxins internally and from the environment. As those nutrients diminish and you increase your total toxic load, your body then begins to show the first signs of dis-ease. It's actually quite predictable, and the good news is that if we know how you began to fill up that proverbial rain barrel, we also know how to empty it to begin the healing process. I was fortunate enough to learn this ancient healing process from my mentor after suffering from debilitating diseases for close to a decade. It was only when I began to implement these techniques did I finally overcome my illnesses and go on to live a life of energy and vitality that I now enjoy. I'd like to share with you now what I discovered after traveling all over the world and how to combine the best of ancient healing wisdom with state-of-the-art science. Allow me to teach you exactly how I've been able to help over 250,000 people to empty their rain barrel and begin to transform their body and lives into what they've always hoped they could be. To get your copy of the international bestseller, The Rain Barrel Effect, simply go to stephencabral.com/rainbarrel.